Hi everyone, my name is Heather Niss, and for my discussion on my advocacy project, I'm going to be looking at environmental racism, which is a huge, huge issue, and it not only affects those going through it, but it does also affect social work practice as well, and it tends to be seemed as easily overlooked and kind of swept under the rug. So, to start off, African Americans are actually more likely to live near hazardous areas filled with waste and pollutants, and with that being said, more than half of the 9 million people that live in these areas are African American and are 3 times more likely to die from lung diseases and issues like that that arise from living so close to such hazardous waste. Specifically for my project, I'll be looking at the South Bronx community where 97% of the population is African American and Hispanic, and kind of the effects that they see at the hands of others and how they're being oppressed, and why this is a social justice issue that social workers should care about and get involved with. So, in the Bronx, issues of illness and death and hospitalization are going up. So, 1 in 4 children are actually diagnosed with asthma within the South Bronx, and the death and hospitalization rates are 5 times higher than the national average. And these are poor people of color who cannot always advocate on behalf of themselves. And this is also spilling over into the waterfront. So, the South Bronx waterfront is now one of the waterfronts facing environmental injustice due to the poor water management that they've seen in the past. And it is surrounded by a 5,000 ton per day waste transfer station, as well as a power plant and the New York printing press. So, due to all the pollutants and pathogens and contamination that has plagued the Bronx and this river, it is viewed as a very high priority area that has a plan for restoration, but it's going to take many years to get it to where they need and want it to be due to the amount of pollution they have already seen come into the lake. Landfills are another big thing that are surrounding the South Bronx community, and 25% of Manhattan's waste is actually being dumped onto the South Bronx landfill. So this kind of just goes to show that whatever New York doesn't want in the more nice areas, they're kind of sending this way and not being very, thoughtful to what the people in the South Bronx are experiencing. And living in areas with high waste radiates like methane gas, which makes breathing issues a lot harder for those, which is why you're seeing asthma rates go up. And the presence of large quantity of trash and hazardous chemicals obviously just has a lot of risk of negative effects. So Fresh Direct is a company that just moved in, and they were originally based in Queens, and they outgrew that location, and then they were going to move to New Jersey, but New York didn't want to lose Fresh Direct's business and income and all that stuff for their community, so they offered them a subsidy package, which moved them into the South Bronx. However, this also brings 1,000 diesel trucks a day. And the positive argument is that they're bringing in jobs, but the community does not really see it that way. They kind of feel like, yes, we need jobs and jobs are great, but also we don't feel like we should have to choose between jobs and clean air. And to kind of make matters a little bit worse, this decision was made without community voices being heard. So the community was called to hear about this 2 days after the decision was finalized. And there's not really a democracy when it comes to things like this. So if they want change to really happen, and they're going to need more of a democratic view. Education. So, educating as social workers is one of the biggest things we can do to help a situation like this. In our Erickson book, the author repeatedly talks about how change won't come unless we educate others, and using the narrative theory to touch on thoughts and feelings and other issues like that are happening is a huge way in taking that first step in working with the community and building trust in order to go about creating change in a positive way. So, along with the education piece of it, though, social workers are also called to advocate. So, we're supposed to advocate on behalf of those who cannot always advocate for themselves. And this kind of means getting involved in more policy practice, which I know is something that I feel a lot of social workers kind of try and steer away from because it's kind of intimidating, but it's something we need to do. And we need to advocate for those who are not able or understand how to advocate for themselves. When looking at what is already being done, the Haven Project is a transformative community plan that has already being put in place in order to improve the quality of life of those around them and promote physical activity and socialization and just all around a more enhanced quality of life. So, through partnership with South Bronx communities like medical centers, the Haven Project demonstrates connections between communities and space and quality of life. And the Haven Project claims to demonstrate measurable health and social outcomes resulting from improved physical environment. So, for example, one of the hypotheses is that if residents have more access to Randall's Island, which is one of the parks in the South Bronx community, the residents' physical activity will increase and a correlative decrease in healthcare costs will be seen. And then the Haven Project moves forward with the NYRP that will harness the momentum to create changes in the landscapes and influence the quality of life. So the Haven Project has a strong coalition of communities, and they work with like the Mott Haven Port Morris waterfront plan, and the NYPR or the NYRP has a history of working with this community beforehand by planting 1,000 trees was the most known thing. So, in conclusion, issues such as those occurring in the South Bronx is a social work issue that needs to be brought to light. And our social work ethics state how it is our job to be workers that pursue social change and for individuals that cannot always do this for themselves. So, a question I would like to pose for those who have viewed this is do you believe that the Fresh Direct coming into the South Bronx is an environmental racism issue, and how would you go about addressing this as a social worker? So, I thank you for viewing, and I'm excited to see what else you guys have. Thanks.